I'm Dr. James Choo with Pain Consultants of East Tennessee.
I'm Dr. Laura Stockdale. I'm a psychologist here, working with Dr. Choo and Dr. Smith for about the last 7 years.
That's right. Yeah. So we're going to talk about a topic that is difficult to talk about, but it's one that's near and dear to my heart because I feel like this is an important topic, especially amongst all human beings on earth, but in particular our pain patients, and that's the topic of trauma.
Okay.
And when we're talking about trauma, I'm not just talking about getting into a car accident, which it can be very traumatic. I'm talking about trauma-informed approaches to treating patients in pain. I'm also talking about potentially adverse childhood experiences, which are...
we've talked a lot about that, haven't we?
Yes, and how it affects health, the immune system, pain patients. And how difficult it is for some of our patients who have experienced a lot of trauma in their past, psychological trauma, mental, physical, sexual abuse, any variations of all of those different problems that people can experience, and how it affects people and their pain. And I think there's our psychologists really help us out to figure those things out and how difficult it is for patients, right?
Thank you for that, but yeah, it's difficult work. It's hard work.
Yeah.
It's labor-intensive work, with not just for the psychologist, but for the patient. There's so much evidence-based research out there that patients don't really care about. But you mentioned adverse childhood experience. There is a high number of individuals that are in chronic pain that have had those kind of experiences. I ask in my assessments, how was your childhood? And they look at me like, what? And there is a high population, density of the population of pain patients that have had those kind of trauma in their childhood. And what the research leans toward is that those kind of events, be they be physical abuse, emotional abuse, sexual abuse, especially ongoing in childhood, is they actually change. I'm doing this with my fingers because it actually changes the irritability of the central nervous system, parasympathetic and sympathetic. I mean, those individuals who've gone through that are more hypervigilant. They're looking around all the time and don't know it, and their nervous system is just so much more sensitive and attuned to danger out there in the world, and they kind of get their signals on a cellular basis confused. This pain comes on, and it's like the alarm system in their body and their psyche it's already hyper alert, and then it just starts firing. Now, the work I do, you were going to ask me something.
No, go ahead. No, keep going.
The work I typically do is I don't mention trauma or dig in there. I will ask about trauma, and then later on, I can say this for the 30 or 40 years I've been a counselor, that even with physical illness or depression or pain, something comes up that was traumatic, or an ongoing trauma, be it not being nurtured, be it being spanked to the fact that there were whelps or blood drawn. I mean, we know now that's child abuse, and so that comes up, and so I try to help them heal from that as much as possible, get their increased hypersensitivity to the environment lower. I use a lot of different things depending on the patient's therapeutic readiness, because some folks they don't want to go back there.
Yeah.
And I let them
understandably, right? For a number of these patients.
Would you want to go back and relive trauma?
Right.
So I have to do that in a very safe environment, and several things. Let them know I'll support them. Let them know that most people, when you talk about abuse to somebody else, the person listening will go, ooh.
Yeah.
And it is horrible. But it's like, we can help you. We can get through this together, you and me as a client. I'm sorry that happened to you. You didn't ask for that. Well, I was a bad kid. No, you didn't ask for this, and it has somehow set your physiological state where things will affect you on a stronger level. I'm not saying that you are imagining your physical pain. I'm just saying your thermostat is set differently. You're going to be more sensitive to anything that happens to you.
And